All right, welcome everyone. So welcome to the Brown Lifespan Center for Digital Health first annual conference, Leveraging Digital Health for the Post-Pandemic World. This conference is being brought to you by our partnership between Brown and Lifespan, our academic medical center and our partner healthcare system, as well as by Mocio, which is a provider of text message services who we've worked with for years on developing, implementing, and disseminating text message interventions. I'm going to start us off with a quick poll, specifically around where you guys are from. So to start the audience engagement, so if you could answer your poll, and while you're doing that, I'm going to introduce myself. So my name is Megan Ranney. I'm an emergency physician. I'm the director of the Brown Lifespan Center for Digital Health, and I'm an associate dean of strategy and innovation at the School of Public Health here at Brown. We're really excited to have you all joining us and welcome you to answer our poll and let us know where you're joining from. Most of us are from the Northeast, with a small percentage from the West. Good morning to those on the West Coast, the Midwest, the South, and outside of the United States. A huge hello to our international audience. I'm now going to launch our second poll. And while we launch the second poll, I'm going to describe a little bit about the course of the day. So after these two polls, we're going to go into a couple of quick videos. A welcome to the conference. Then I'll provide a little interview. We'll have our wonderful keynote panel. And then as the day goes on, we'll have a number of other short panels. You can join, come back, all using your own video link that you've received for today. We hope that you'll stay for as many of the panel discussions as you're able to. And I'll highlight at the end of the day, we have a special session with a number of student presentations. Students from across the country have worked hard on both doing the work and putting together the posters that they'll be presenting. So I do urge you to stay for that end of the day poster session. So I'll ask you all to fill out the second poll. And while we're doing that, I'm going to have media services pull up our videos to welcome you all. So let's see the votes on our second poll. What are you most excited to learn and discuss when it comes to digital health? So I'm thrilled to see a variety of answers here because we're covering all these topics today. In our keynote, we're going to lay out the basics of where we've been and where we're going. In our second session, we're going to talk about how to define and measure outcomes. Third session is looking at social media impact on behavioral health, on these forgotten epidemics of violence, substance use, and mental health. And the next panel is on digital health investment, and then engaging community voices in the creation and dissemination of digital health. So a little bit for all of you, and I'm excited to see the distribution of answers among your poll results. So with that, I'm going to have Jake launch our videos, and then I'll be back in just a couple of minutes.
Hello, I'm Jack Elias. I'm the Dean of Medicine and Biologic Sciences and Senior Vice President for Health Affairs at Brown University. I'm excited to officially welcome you on behalf of the Warren Alpert Medical School to the 2021 Brown Lifespan Center for Digital Health virtual conference entitled Leveraging Digital Health for the Post-Pandemic World. As Dean of the Medical School, I have witnessed our Brown University community find resilient ways to prevail through the last 15 months with the use of novel digital health tools to help keep our community safe. Now, with the world opening back up, it is important that we use the lessons from the recent pandemic and begin applying similar digital tools to other behavioral aspects of health, including those of mental health, violence, and opioid misuse. That is exactly what today's conference will be exploring. Additionally, as we work toward building an integrated academic health system with our hospital affiliates, it's important that we continue to use translational research practices to reduce current stigmas, barriers to care, and the lack of effective treatment when it comes to diseases and public health issues. A bench-to-bedside approach, strategically informed by innovative humanistic technology, is a clear route to drastically reducing major health issues and ongoing epidemics in Rhode Island, the surrounding region, and beyond. There is a clear future for humanistic technology in medicine, and I'm excited that the Center for Digital Health will allow us to explore this future today. Thank you for joining us and enjoy the sessions.
Hi, I'm Dr. Tim Babineau, President and CEO of Lifespan. From the very earliest days of what we were then calling the novel coronavirus outbreak, it was apparent that the physical and mental health of patients, healthcare professionals, and the public was at risk. The Brown Lifespan Center for Digital Health's mission is to utilize the best of technology to seamlessly maximize health and eliminate health disparities, with a primary goal to be able to quickly scale up digital treatment modalities in order to have broad impact for both patients and the population. This was a godsend during the pandemic. I am extremely proud and humbled by how our system came together throughout this pandemic. The old adage that every bad situation has something positive was shown to be true in this case. The coronavirus pandemic forced a surge in virtual healthcare, including telehealth services, nurse hotlines, video conferencing, and remote patient monitoring. I think the positive outcome from the pandemic is the explosion of technology to help patients get access to care where and when they need it. Telehealth is also proving to be beneficial in ensuring that more people get access to much-needed mental health services. Even with the return of in-person visits, we can see that virtual care is not going away. Patients have made it clear that their demand for digital health care is here to stay. As a CEO, I know that technology is the future, but I also know that we need to demonstrate outcomes. I look forward to discussions of how we can do this in innovative ways. Thank you.
Thank you. A huge thank you to Dean Elias and to Dr. Babineau for providing those opening remarks for us. We will have some further remarks by Dean Jha from the School of Public Health coming in a couple of hours in between a couple of our other sessions. So with that, I'm going to launch into a little introduction to our keynote panel around digital health in the post-pandemic world. So when I'm trained as an emergency physician, and when I talk about healthcare and what the purpose of healthcare is, I think that many folks, knowing that I'm an emergency physician, and people who don't, think of healthcare as this, right? It's all about time-sensitive conditions, particularly in this era of COVID. It's about minutes counting in saving lives. It's about trauma and CPR and intubations and sepsis, and about things that need a team in person in the moment. But over my last 20 years as a physician, I've learned that both the emergency department and the healthcare system in general are about so much more than those time-sensitive conditions. It's about the underlying drivers behind what brings people to my emergency department in the first place, whether that be a history of childhood trauma, ongoing violence in the home, anxiety, or depression. These conditions both potentiate the underlying physical disorders and often lead to them. There's study after study showing that women who are victims of domestic violence are more likely to develop stress-sensitive conditions, hypertension, have earlier heart attacks, have more autoimmune disorders, and so on. And I know that many of the diabetics that come to the door of my emergency department are there not purely because of diabetes, but also because of the underlying behavioral and social drivers that prevent them from being able to take their insulin on a regular schedule, to purchase insulin as intended, or to follow the food recommendations of their physicians and primary care providers. And for many of us within the healthcare system, with this realization that the care that we provide is not just about fixing those time-sensitive conditions, but also about helping people to achieve their healthiest sense in every part of the world. This is the motivating force behind the work that I do and that our keynote panelists do with digital health. We see the ideal state of health and the ideal role of the healthcare system as providing a front door to a healthier self, where we don't define health just in terms of physical well-being, but also in terms of emotional, social, and truly a holistic sense of what health can and should be. And in an ideal world, this is what a healthcare system does, right? Is open the door to a healthier person in every sense of the word. And this is where digital health comes in. So I know many of you who are attending this conference today are quite familiar with digital health, otherwise you wouldn't be here, but it's nonetheless worth starting with a definition of what digital health is and isn't. So in its simplest form, digital health is the use of technology to address health problems. Many people think of this as its simplest format, which is telehealth. And we will talk a little bit about telehealth today over the next few hours, right? Telehealth is the use of synchronous or asynchronous services to allow healthcare providers to provide what would normally be done in person, an assessment, sometimes even a physical exam, diagnosis, and treatment. But digital health is so much more than telehealth. As we'll talk about over the next few hours, it's also about the use of social media to identify or deliver interventions to those at risk. It's the use of wearables to help motivate or measure health changes in health behaviors. It's about the use of apps and text messaging. Texting is where I got my start in digital health, as did some of our other panelists, to help connect with patients, to mitigate that anxiety and the behavioral health problems, and to help change, again, the underlying behaviors that lead to poor health. And it's about totally novel strategies, some of which are still in development. The picture of a pill bottle on here, there's work that's being done, obviously, with helping geriatric patients, psychiatric patients, to maintain taking their medications at the right time. But there's a world of work being done with optics and remote monitoring, some of which we can barely even scratch the surface of at this point. That too is digital health. This field is really about so much more than just telehealth or informatics. It's about all of the ways that we can use the technologies that touch every part of our life to help improve our health. When I talk about digital health, and as we enter into this conference today, talking about the post-pandemic world and how digital health can play a part, I think it's really critical for us to talk about disparities in access. Many folks assume that digital health is for rich white people. But one of the reasons that I work in digital health as an emergency physician is because that's not what it is, at least not when designed intelligently. These surveys from the Pew Research Center show that although there are real digital divides in access to desktop and laptop computers and in access to home broadband, almost every adult American, regardless of race and ethnicity, owns or has access to a smartphone. Moreover, lower income, and obviously race and ethnicity is not the same as income, but lower income Americans are more likely to rely on their cell phone or their smartphone to get online. And one example of that during the pandemic world, right, is the access to vaccines. There have been a lot of media articles written about how horrible technology-based enrollment for vaccines was and how that worsened disparities. But the reality, if you dig deeper, is that technology actually helped to mitigate disparities in access to vaccines when it was designed and deployed in the right way. There are a number of programs across the United States that used text messaging and mobile optimized, very short web forms in order to enroll folks in vaccines, in order to access those who were minimally health literate or minimally literate, in order to enroll those for whom English is not a first language, in order to enroll those who may not be US citizens. And those text messaging outreaches, those directed mobile phone outreaches, and even some social media information became critical ways for us to mitigate those disparities. An example during COVID that I hope that we will carry forward and we'll discuss during this keynote panel, talking about the use of digital health in the post-pandemic world for those underlying epidemics that I alluded to of violence, substance use, and mental health disorders, which we know were there all along, just like racial and ethnic disparities have been in our country all along, but which have gotten heightened during the COVID-19 pandemic. So this is background. This is the motivation for our Brown Lifespan Center for Digital Health, which, as I mentioned, is a partnership between Lifespan and the Warren Alpert Medical School of Brown University. We have 4 goals. The first is to do great practical research. The second is experiential education. We educate across the spectrum from undergrads and high school students up through faculty. The third is scaling for impact, which is about working with both commercial partners and entrepreneurs and with community groups to help develop and disseminate best practices. And the last one, and the motivation for this conference today, is about collaborating to innovating, creating a space where patients, communities, researchers, and clinicians can all work together to bring our diverse perspectives and experiences to move the field forward. And although we cannot gather in person, thanks to COVID, This virtual format allows us to be a little different. We have folks today, as you guys saw from that first poll, who are literally coming from, not just from across the United States, but across the world, to help think together about what digital health for the post-pandemic world can look like, and how we can use these tools to advance care of, treatment of, and prevention of those underlying epidemics of violence, substance use, and mental health that drive so many of the physical problems that we see every day in our healthcare systems across the US. So with that, I'll stop with my intro, and I'm absolutely thrilled to bring our panelists on screen. And while they come on, I'm going to start to introduce them. So we have 4 amazing panelists in our keynote panel. You've met me already. The first of the panelists is Dr. Adrian Aguilera, who's an associate professor at the UC Berkeley School of Social Welfare, as well as an associate professor at UC San Francisco's Department of Psychiatry and Behavioral Sciences. Adrian and I have known each other for years from our parallel work in text messaging for mental health. And at UC Berkeley, Dr. Aguilera has absolutely shown and grown this field. He directs the Digital Health Equity and Access Lab, as well as the Latinx Center of Excellence in Behavioral Health. And at UCSF, he directs the Latino Mental Health Research Program. His focus is on developing and testing technology-based interventions to address health disparities in low-income and vulnerable populations. So that's Dr. Aguilera. Next is Dr. Castro. So Cynthia is the Senior Director of Clinical Research at Modern Health. She's a clinical psychologist who leads the research team at Modern Health, a comprehensive digital platform that produces evidence-based mental health care for enterprises around the world. She has a PhD in Clin Psych, worked in academia for many years before making the leap to industry, left her NIH-funded research career from Stanford to go to Amada, where she was Director of Clinical Research. And now at Modern Health, her goal is to execute a strategic roadmap of high-quality clinical research that showcases Modern Health as a best-in-class leader in digital mental health solutions. Our third panelist is Dr. Trina Histon. She's the Senior Principal Consultant in Prevention, Wellness, and Digital Health at Kaiser Permanente's Care Management Institute. Trina has a PhD in health psychology from University College Cork, Ireland. So we're glad to have our international representation here. And she's well known within the field for her extensive career in addressing prevention, well-being, behavior change, and emotional health by translating evidence into practice. She's been working in the digital health space since 2010 and is currently co-lead for Project Shamai, which is Greek for grounded, deploying an ecosystem of digital mental health tools at Kaiser Permanente to support emotional wellness. Finally, last but not least, is Deena Shakir, a partner at Lux Capital, which is a multi-stage venture capital firm with over $4 billion under management. Deena invests in transformative technologies, improving lives and livelihoods. She's particularly interested in contrarian and underdog founders building ambitious companies in digital health, and sits on the boards of numerous companies related to the topic of our conference today around mental health, substance use, violence, and healthcare in general. The daughter of Iraqi immigrants, Deena has had a very nonlinear journey into the VC world, but always orienting around how you can use tech and entrepreneurship for impact. She'd worked at Google, she was in the Obama administration, she worked in Secretary Clinton's office, and has been at USAID as well. So we're absolutely thrilled to have these 4 speakers joining us. Welcome, you 4. It's a treat and a pleasure to have you all. So with that, I'm going to stop talking and I'm going to let them talk. So I'm going to go down Adrian, Cynthia, Trina, and Deena. I would love to hear from each of you. What's the most compelling or eye-opening lesson you've learned during the COVID-19 pandemic about the overlap between digital health and these forgotten underlying epidemics of behavioral health, mental health, addiction, and violence? Adrian, I'll start with you. What's your most compelling lesson?
Sure. I think this is something, in general, I think what COVID has done is exaggerated a lot of what already existed. And I think one of the things that I've noticed is that as a proponent of technology-based interventions, the clear realization that technology is can be both the blessing and the curse. And we have to find ways to balance this out, right? So technology can scale our interventions, information that we can provide to others, but at the same time, there can be increased disparities depending on who gets those interventions. And so that brings to mind all these issues that we talked about, that were brought up earlier, about humanistic design, about focusing on disparities, and things like that. And I'll just end with the example that I think about the blessing of the curse, and thinking more nuanced, is that initially more people were able to get to their mental health appointments when there was a move to virtual care. And so that was great. We were able to get fewer no-shows. But then what we saw later on, at least from providers that I've talked to, is that onboarding people has been more difficult when it's all virtual. So we have to find this kind of the how and when to apply digital. And that's something that I think we're learning, and hopefully something that in academia we can kind of research and find the right tools for.
Thank you. I love that phrasing of it being a blessing and a curse. I'm going to borrow that. Cynthia.
Yeah, I think, what I was really struck by during COVID was the, and I struggle with how to describe it, but it feels like there was an increased kind of comfort level amongst the US of people talking about mental health. And I don't know if it was comfort or if it was just kind of that tipping point where the urgency and the need for it kind of, propelled the conversation and made it more public and made it more acceptable to people talk openly about the fact that we all have mental health, right? And it runs on a spectrum. And when we talk about mental health, we're not just talking about severe mental illness. We're talking about, a whole myriad of experiences that we all go through. So I was really struck by how we really shifted our conversation as a country and around the world about the importance of mental health, where it emerged on our priorities of how we take care of ourselves. And I think, with that accelerates the demand for solutions and for solutions that really are person-centered and meet the needs of the people who are seeking relief. So I think it's been a terrible reason, but a great outcome that we all, I think, talk differently about mental health and more openly about it. And there is more receptivity to it, and we're reducing the stigma of it. I still think we have a long way to go, but I am really encouraged and hopeful that, we've really opened a new chapter in this country about mental health being a part of our entire platform of healthcare solutions for our population.
Thank you. Trina, what have you seen as kind of the biggest takeaway lesson?
Yeah, and thank you again for the invitation to speak today. Really appreciate it, to share the work we've been doing at Kaiser Permanente. I think the biggest aha was how quickly we accelerated in healthcare, which is usually a risk-averse industry. I think we probably innovated a decade in that space of 2020. And so the silver lining, I think, for the work we've been involved in Kaiser Permanente in deploying a digital mental health ecosystem was the rapid acceleration. We were part of the COVID response. So to give you a sense of some numbers, January 2020, before we knew the world was going to change on us, we trained about 562 clinicians in referring to 6 digital apps built into the EMR, figured out how to do all of that. And by May 2020, when we were really seeing all of this unfold, we had about 1,600 clinicians trained, and then pivot to the end of the year, 2,400 trained. So we literally increased the referring pool of clinicians who were learning to deliver care virtually. So went from face-to-face to virtual, over 90% of care delivered. So a 300% increase in the clinicians referring, and a 10-fold increase in the number of referrals given to these digital solutions, whether they were mindfulness meditation or cognitive behavioral therapy. And so even though our doctors, our therapists, psychiatrists, primary care doctors, etc., had to now pivot to delivering care virtually, they were able to put digital tools into the virtual channel. And I think one of the things that was poignant for me, one of our leaders in Southern California, Dr. Tim Ho, had reached out to say, can we open these tools up to primary care? Because the traditional methods of displaying empathy, like leaning in to listen, having eye contact was a little more challenging to do in a virtual visit, whether you're on the phone or on camera. So being able to give something tangible at the end of the visit to support the increased distress people were experiencing for not sleeping or pandemic-related anxiety meant they could give something tangible, which felt good and also was something real to put in a patient's hands. So I think the receptivity to these tools and figuring out how to refer and for patients to receive them, I think is a silver lining, and we continue to deploy them at high pace. So I'm very gratified to see that continuing even as we're hopefully coming out of the pandemic. That was
Fingers
my
and
biggest
toes
aha.
crossed.
Yes, Delta variant aside. Yeah.
Thank you. And Deena, how about you? What was your biggest takeaway from the pandemic around this work?
Yeah, thanks, Megan. You know, for me, it's my job to invest in really kind of cutting edge technology that is improving human health. And so it's been a really stark juxtaposition of this incredible opportunity where there has been forced behavior change across all stakeholders for the most part in healthcare, the providers, even the payers, and certainly the patients, and in some cases pharma. But at the same time, despite these tailwinds, we're seeing inequities, to your point, existing epidemics or endemic issues being exacerbated by the opportunity. And so what's really top of mind for me is I think about how we can catalyze on this momentum, how we can invest in the next generation of truly transformative healthcare. How can we do so in a way that is not at the expense of the majority of the country that really is in need and that we've seen through this pandemic at the most. And so I think there's a real challenge ahead for those of us that are innovating, investing in this space. There is an opportunity, but there's also a risk that we continue to sort of exacerbate this digital health divide.
I'm going to go off of that, Deena, and kind of talk a little more about the challenges, whether it's around the kind of economic or racial and ethnic divides in access to digital health or others. But I'd be interested in all four of your perspectives from the different, hats. Each of you have overlapped with each other's worlds over your careers, but from the seat that you're seated in right now, what you see as the biggest challenges to expanding the pool of digital health tools for these kind of underlying behavioral health issues. And Deena, I'll actually start with you since you brought up challenges.
Yeah, absolutely. I think at the most basic level, it's that there's still a significant portion of the world and certainly the country that does not have regular access to even basic connectivity. And so anything that is inherently digital, we saw this with schools going online and so on, that will continue to be a problem, especially for really high bandwidth solutions. And then the second one, which again is fairly obvious and hopefully not a novel observation, is just around reimbursement and, health equity, and that a lot of the solutions that we're seeing are starting off in this sort of quote unquote direct to consumer, although those of us in healthcare know there's really no such thing. There's usually a provider somewhere in the mix. But these out of pocket solutions are just completely inaccessible to the vast majority of patients who need care. And finally, I would say another thing that we've learned, in part in the last year due to the pandemic, but also due to some, other issues that came to the forefront of civil discourse, is around the sort of personalized nature of care that is required, particularly in behavioral health, but certainly across other indications as well. And so the ability to match patients with providers with whom they can relate, who are comfortable and understands, social determinants as well as physical determinants of health, is a real challenge for providers. And again, while there is a sort of a deluge of funding and companies out there, that piece of it is something that still, I think, remains to be solved.
I love it. And as you mentioned, each of these challenges, I'm looking at the other three panelists and I'm like, I'll bet that all three of them have ideas on each of the challenges that you've mentioned. But so I'll actually go to Cynthia next, given kind of, you talked about that kind of reimbursement part as a challenge. And I have an expectation that you'll have a thought about that, but would also be interesting.
Nodding my head. Yeah, so there's plenty of room for, all of the digital health offerings that are out there for mental health. I come from the business to business world, so we don't go direct to consumer, but we market our products to employers who are the largest insurers of Americans to make our program available to their employees. And there's plenty of competition in that space. And unfortunately, there is plenty of room. There's room for all of us. There is enough need to go around. However, the choices are gated by the decision makers, right? And people, I think, are still pressed to look for that one solution, be it because it's economically driven or just a notion that there is that one right fit for everybody, when I think all of us scientists know that's not, true. That's not really how it works. But the choices that are available tend to be gated and restricted. And then when you go into and in our country, it's all sort of dictated by your insurance, and that determines what kind of healthcare you get. And so when you move into the government funded insurance mechanisms of Medicare and Medicaid, then you layer on the regulations and the state by state restrictions. And so for all the great solutions that are out there, there is still some distance to close to get those choices to people. And I really believe it should be about choice and access. And there is no one right solution. We should be giving people options, but we're really not structured as a healthcare system to give those options, or we really restrict what options are available. So I don't have solutions for that, but that's one of the challenges I think we really face, and which is why I'll tip my hat to Trina and what Kaiser is doing about trying to build more options for people. And maybe this is a good ball to bounce over to her.
Trina, that does go nicely to you. So
got the ball. Yeah. Thanks, Cynthia. So I would say, in addition to the equity, inclusion, diversity issues, which are very, very important, there's also maybe a sense of a culture clash between those of us in healthcare, which is first do no harm, and then the classic Silicon Valley, which is an hour down south for me, move fast and break things, and that can often put us ill at ease in healthcare. However, I would say, the work we've been doing, there's so much unmet need. We can step into a space together with humility and figure out how to begin to meet that unmet need. So in our journey, part of the solution is understanding, learning styles, and that's why we've chosen 6 for now. It's an ecosystem that will grow over time, that ostensibly deal with depression and anxiety. But we were looking at solutions that knowing our member base might have very restrictive data plans and or their shared phones. Are some of these tools, can you download over Wi-Fi and then consume later on? And so some of our solutions have that, in addition to, some having a coach feature if somebody wants to connect with somebody, to guide them through a cognitive behavioral therapy journey. So we were really thinking about all of those elements. But I will say, you form a partnership when you start working with digital health companies. It's not you're buying a product off the shelf and then you deploy it in healthcare. There's ongoing dialogue because these solutions are always growing and adding to their toolbox, if you will. And in fact, we've been able to influence product roadmaps to get more programming to meet more of our members' needs. So that's a value add of the partnership we have. But I would say there's still a journey to go beyond the English speaking experience. So many of the solutions that have been around for over a decade, they're sort of the old guard, if you will, are beginning to add programming in, say, Spanish and other languages. And, we need that, but there's still a paucity of that in mental health. And then I've just completed a digital scan in the weight management space for diabetes prevention. And there's still a journey to go to stand up content in languages other than English. So that is the opportunity of this decade, I think, for those of us in healthcare and those of us passionate about digital health, to make sure we're figuring out the human touch to digital support and making sure we're offering more healing for more people in that journey, including that lived experience of that individual, because they won't engage in a tool no matter how good you've designed it. If they don't see themselves in the solution very early on in the user experience, they will leave. And I think that will be, one of the challenges we need to navigate together.
So that is a great ball to toss to Adrian, who has been working in this area for a while. And Adrian, I'm interested both in your response to Trina's great comments and also kind of what you see as the big challenges that have gotten heightened or become obvious to the world during COVID-19.
Yeah, I think my short answer is yes to everything that's been said. I think obviously this is an expert panel that has their finger on the pulse, right? I pay attention to issues of equity, and those are things that are coming up. I think broadly speaking, there's so much need that we, as everyone's mentioned, we need solutions for everything. I think what I would like to see is more focus on the highest cost, highest burden challenges that our healthcare system faces. And that is often at odds with the kind of consumer first models that the private industry comes in with. So it would be great to see better incentives to do that, so that systems of care can actually move, to continue moving at this pace, basically. So all these issues of blending technology and human, issues of language, that's a very simple thing. If we just translated so many of these tools and done some cultural adaptations, we can have much more impact. I think, broadly speaking, we've done a lot of trickle down digital health, and that hasn't really gotten us where we need to be.
Trickle down digital health. That amen. Well, I go on to our next question. I'm actually going to ask media services to launch our fourth poll on barriers to uptake of the tools. To the folks that, as you answer, you'll note that some of the barriers that are in there that we've just discussed weren't even listed. We were limited in the number of poll choices that we could have. So I'm interested in the audience's thoughts on what they see as the barriers to uptake of tools around digital health for mental health, substance use, and violence. So while folks are answering the poll to my panelists, I'm going to switch the question and take a strength-based approach, which is, what is the thing that you're most excited about? Like, what have you seen in the last year that you think has the potential, and we've touched on these a little, but it is the potential to be the most transformative for the use of digital health for these underlying behavioral health epidemics? And I'll let whoever wants to answer go first. And if not, I'll call on someone. But what gets you like most excited that you think 3 or 4 years from now, we're all going to be sitting here and talking about? And just please don't say AI as in and of itself. Will be my one plea. If you say AI, qualified and talk a little more.
Yeah, I'm happy to jump in there if no one else is going to do that. So there are several things, and I kind of see them as Russian dolls opening up over time. I'm excited about new models of care. I referenced earlier sort of the human touch to digital support, and I think there'll be tremendous work done in this decade to really figure out the right level of human support to digital support, because you can have continuous data coming in from the digital devices that is different to and perhaps richer than the point in time we generally have in healthcare. I'm also excited about an evolution in frameworks, in knowing what good looks like, because there's so much noise in the field, and it's doing the digital health field a disservice, candidly. So I think about, I'm watching closely what Germany's doing, because they've kind of set up the framework to the payment model, to the deployment. I'm looking at Belgium and Australia, and I'm hoping, I know the Digital Therapeutic Alliance and other groups are coming up with frameworks to determine what good looks like. In the mental health space, again, in the last year or two, work done out of Beth Israel Deaconess by Dr. John Touros, who also helped shape the American Psychiatric Association's criteria in the digital mental health apps. They have digitalpsych.org, so you can go in and look at different apps and how do you know what good looks like. So this data is becoming more at our fingertips. Another group, CyberGuide, also has a nice set of criteria. If you're looking for apps for sleep, they can guide you. So seeing more evolution in the standards and expectations of, if you're building a digital tool, what it needs to have. Also excited about more real world evidence and more rigor and thinking, coming into that, and then great work going on by the likes of Camille Nebeker at UCSD on ethics in digital health. So this decade is to cut the waterfront there. And then we have tons of data, but we're kind of insight poor in some ways. So I'm excited about, you referenced AI, but I'm excited about what we can learn from the machine learning capabilities of paths through digital tools that can show us which path can somebody take to feel better faster. And that's already here in some digital tools. So I'm excited about the growing use of insights to hand back to clinical teams, but also to the individual, so they can get more insights and awareness in their day. So they're all the things that excite me in the Russian dolls, and there are probably more, but I'll stop and let other panelists speak.
I love it, Trina. You covered so much. I totally agree with you on all of that. I can chime in, Megan, on some additional insight.
Go for it, Deena.
Yeah, and really just to double click on one of the points that you made, Trina, but I would say, as we think about kind of the next wave, in a way, it's almost like thinking about how meetings, face-to-face meetings now are, in this digital forum, and we're looking at each other in a certain way, and which is a little different, but really not so different than a meeting in person. And So what I get excited about in terms of the virtual care side of things is how we can move beyond just the video experience to actually delivering better care, to studying, and whether that's through real world evidence or through clinical research, what better modes of care delivery are out there, and specifically to your point, Trina, around measurement and outcome, which has long been a challenge in behavioral health and a fascinating opportunity. How can we begin to understand with more precision and ideally mitigating potential for bias, especially the type of bias that can be pervasive with certain novel AI? How can we better understand what is working and not working? That to me is really exciting. I know there's scant evidence on digital biomarkers and in particular for mental health, but it's early days. Perhaps there's more there. Perhaps there's more around imaging, on pharmacogenetics and precision medicine, predictive medicine. There's so much, I think, especially with healthcare moving into the home, even with actual physical biomarkers, that we can, we're just at the precipice of understanding now that all of these things are a little bit more accepted and commonplace because of the pandemic. So that's really what excites me, is better, more precise care delivery and measurements and outcome.
Thanks.
I would say that I'm excited about a lot of kind of the new technologies and so on, but I follow kind of Gartner's hype cycle and try not to get overly excited because these things then lead to disappointment, right? So I think thinking big picture, I'm excited about the system level changes, right? The ways that telehealth has been brought on and moved so quickly and been adopted quickly. And so I'm excited that, coming from more of the healthcare system side, that we're thinking about ways to integrate it. And so I imagine a world in which we have something like step digital care, right? So some of the things that Trina has mentioned. So, technology for some folks, and that may be enough. Some folks may need technology plus support, maybe from peers. Others may need more intervention or psychotherapy, for example, plus some technology. And others are just going to need more intensive personal support. But if we distribute those resources properly, then we can actually reach the promise of scale. So I think moving towards that is exciting to me.
Awesome. And
I'm gonna take advantage of going last to say there's two things. I won't just pick one that I find exciting. One, I have been really impressed by our ability to expand digital mental health services to go beyond depression and anxiety and transient sleep problems. We're seeing more programs available for things that we really used to think only could be done face-to-face or with a provider. So like eating disorders, PTSD. So we're really seeing, there's a lot of areas of mental health that can be transformed into digital solutions, but with that opportunity comes a lot of responsibility, right? And doing it right and appropriately and ethically. But I'm really excited about the opportunity to give people more options and not kind of segregate the type of mental health for the type of issues that people are dealing with. And along that same line, number two, humans, we're complicated animals, right? And we don't just have depression. We don't just have diabetes. There's people walking around with multiple health concerns and priorities and challenges. And for a while, we've been a little bit siloed and solutions kind of by condition. And so I'm challenged by and excited by the move towards treating people more holistically and having more complex platforms and digital health solutions that treat the whole person and understand the whole person and all the things that they bring into their healthcare interactions. I think that's really where we need to go. But we kind of come from disciplines where we're really good at being really good at what we're really good at, right? And that tends to be very selective. And we need to learn how to work more interdisciplinarily and cross-functionally and really kind of work more of a kind of moving more towards a polyclinic view of digital health. But that's going to require a lot of players kind of figuring out how to make these things fit together.
That it's like the poly pill for hypertension and hypercholesterolemia and for some low grade glucose control. but for doing it for all of the behavioral health disorders that underlie our physical conditions. I love it. And I will say, as we talk about frameworks, that our next panel is specifically on metrics and frameworks. And we have Matthew Diamond from the FDA, who's going to be joining us as part of that, along with some great practitioners who've been doing good work around this area as well. So I'm actually going to move, Cynthia, a point that you brought up is something also, I'm going to move a little bit into some of the Q&As that have been being put into the Q&A. Jake, if you could bring up the answers to the last poll around the biggest barrier, and you'll see folks' largest concern is exactly this lack of integration, right? So there are all these tools out there and we just don't have them integrated yet. But the second highest concern is privacy. And we've gotten a couple of questions about that in the Q&A. Trina, you had mentioned Camille's work, which is obviously setting standards for us as we think about ethics and privacy. It's something that we deal with at the Center for Digital Health. You know, we do a lot of work with adolescents around violence and mental health, and there are ethical concerns both about how we get them enrolled and what we can or should tell their parents, right, around enrollment. And so I'd love to hear you guys, your musings on how you're navigating this area, right? And I'm going to say, you know, I have the recognition that the public sense of privacy and ethics is constantly shifting. Right. So we have our very standard IRB for when we're doing research, there's the human subjects protection. But when it comes to consumer facing digital health apps, if they're not affiliated with a covered entity that has to follow HIPAA, or if they're not being done under those standard research protections, it's a little bit of the Wild West still. And how folks are reacting to that, I find has shifted over the last 5 years. So I would love your thoughts about kind of those ethics and privacy questions around digital health for behavioral health disorders. Adrian, I'm actually going to turn to you first for this one, because I know it's a space where you've spent a fair amount of time, and then I'll let others jump in as needed.
Yeah, thanks, Megan. So much of this issue around privacy has to do with trust, right? And that's so ingrained in behavioral health. And what we've realized is that when these things come, I think related to the integration in healthcare, when these tools come from a provider, let's say recommending them and being engaged in the process and the full loop of digital, then there's more, patients tend to take this up with more ease. And some of those privacy concerns are lessened to some degree, right? Because there's trust based on the provider relationship. And so obviously we need a base level of privacy to make sure that our solutions are secure. And then on top of that, we need to leverage these human relationships, right? I think for many years, we just expected digital to take care of everything. And we're realizing that's not going to happen. And this is one way in which the trust of the healthcare provider can be leveraged. So I think that that's a huge element as we, at least in terms of uptake and getting folks to buy in.
Trina, you want to jump in there?
Yes, I'm just happy to, because the trust resonates with me. You know, the engine of our work has been human-centered design. So really understanding from our clinicians' perspectives, their receptivity to digital tools and how they might fit in their workflows, and then with our members in terms of their life journey and what they would need. And so trust was the number one area. So we obviously in healthcare take that very seriously, and we're a highly regulated industry. And so in healthcare, we've category 1 data, it's data derived in our EMR labs, etc. And apps tend to be category 2 or 3 data. And I think the journey we've been on is to think about ensuring that the same HIPAA compliance and privacy concerns and interoperability and data security, all the things we care about as a standard in healthcare, app companies are stepping into that space. So we don't design down, we design together to make sure the data exchanges, the referrals we have, the data the app companies have used to, no third-party sharing, no offshore servers, all of those things that we have in our technical risk office review, and any of the app companies we work with will tell you that's quite an in-depth process. We want to make sure we're bringing that trust, into our organization if we partner with an app company, because that's the expectation for us in healthcare. And I do think the public perception is changing. If you look at, Gen Z or millennial, they see the convenience and they trade off that. But as they get older, those digital traces may or may not come back to haunt them. So we want to make sure if they're using an app in partnership with healthcare that, we're we're taking that very seriously. Obviously, if they're on other social media platforms, we can't control all those things, but we want to bring a degree of rigor into that conversation, and there's sort of privacy then and transparency. So yes, it's private unless you're disclosing to us, you're at risk to yourself or to others. And then again, we have protocols in place to manage that, especially in the mental health space. So we've built all of those and continue to refine them as we get, not doing the trickle down digital health. We've been very intentional in our design because we knew if we did it that way, we might get 3% engagement. But this is why we're getting the results we're getting in our deployment, because we've thought about all of those pieces. But still much to be done in an age where 3 data points can define who you are. So we want to make sure we're taking that very seriously.
Love that. Cynthia and Deena.
Yeah,
and I'm going to have you guys, I'm going to say, I'm noticing the time here. It is 12:54. I would love to get to one more quick question. There've been a lot of great questions in the chat. So I'm going to try to get to one more question after the two of you kind of give your kind of thoughts around the ethics and privacy.
Yeah, sure. So I've only worked for companies that have operated as covered entities. So that's been a blessing, even though it is a lot of regulation and guidelines to follow. However, I think it does pose challenges when it comes to providing a great experience for the member, because there are times when people don't understand, well, why can't I just text my coach with my regular phone number? Why can't we just have a phone call or a Zoom call? We need to think about all the privacy and security guidelines that we need to put on the interactions between our members and parts of the platform that they're using, whether it's digital tools or live interaction with a coach or a therapist. So I think the challenge comes in helping people understand, it's for your own benefit, even though it doesn't feel like it, but it doesn't make for a great experience to have to, go through the platforms. And I think from a provider standpoint, the challenge for us is, there's quite a bit of information that we can't access. What really happens with the provider in that therapy session that we could learn from? There's a lot of information we're not going to be able to glean from that, especially if providers are just getting connected to us through our platform, but they're delivering the services under the umbrella of their own provider services. So it does. As important as the ethics and the security guidelines are, it also does, limit our ability to get information back and to learn and get some details that'll help us provide a better experience. But, those are important guidelines that we have to work under and solve for.
I'm happy to chime in quickly. I know we're almost out of time. I'll just add briefly that I think, 10 years ago, the HIPAA piece of it was such a big, lift. And I remember working on Google's first HIPAA compliant product, and it was amazing when we launched that. Now that's just the basics. So there's a lot more to it. And especially with many consumer companies now sharing health data with providers or enabling that option. I think the question around ownership of data, around terms and conditions, there's obviously a huge opportunity to innovate on top of that kind of data, but there's also, constraints around awareness and privacy and sort of this notion of patient ownership that we need to take into account. And in some cases, those seem like intersecting priorities on the innovation side, particularly with real world evidence. So I'll pause there just to let you get to the last question.
Thank you. I love it. And there's I will say we can do, maybe next year we'll do a whole conference on kind of ethics and patient privacy and trust, because it is a topic that I think we could dive into for hours and hours. So my last quick question is, each of the four of you come from very different perspectives, and a few of the Q&As that have been put in have been really kind of getting at how do we work together. So I would love, from the perspective of academia, business, investor, healthcare system, what one thing do you wish that the others knew about the way that you work in digital health? Like what would be your one takeaway to the others about kind of your viewpoint? And hopefully this can help create some conversations among attendees as well as among each other later on. So what would be your one kind of takeaway about the core thing about kind of your work that you wish that they knew or could kind of take on?
I'll jump in. So coming from like the real world, digital health provider side, we are not interested in reinventing the wheel, right? And we know that there's plenty of great evidence-based therapeutic modalities out there coming from academia, but we need help finding them and making, like, leveling the field for all digital health players to look for evidence-based solutions and to find the best of what academic research has to offer. You know, we will always have a need for that fundamental research that comes from, you know, mostly federally funded research, but that second part of it, the translation, the dissemination, you know, that gap still remains. And so, you know, I think we're desperately trying to reach and find it just as much as academics are trying to get it out there, but we don't have a great mechanism that naturally brings us together to find the best of what we both have to offer and create a need for a partnership.
That's awesome. Thank you.
Yeah, I can build on that. Oh, go ahead, Adrian. Go ahead.
I'll just add quickly, as the academic side of things, I think one of the things that's important for folks to just get a sense of is that in a lot of ways we run on a shoestring, right? We're trying to do a lot of things with small teams, and I think our main motivation, the thing that, you know, we get judged on, frankly, is knowledge production, right? And understanding, you know, if in my case, principles of digital health and things like that, and kind of they seem small, but they seem like small things, but we go deep. And so we have limitations, but that's kind of those are the constraints that we operate under.
Yeah, I think from my perspective, the context within which the digital tool is being deployed is super important. I don't think it'll behoove us if it takes us to traditional 14 years to move from publication to frontline deployment. We really need to rapidly accelerate. And part of the journey will be understanding the environment in which your app or solution will be implemented. And the other part is that generation of real world evidence that you've both touched on. You know, how do we know something will work in the real world? Because the publication is great, but it's not sufficient in its own right. So they're the things that I think about quite a bit.
Thank you. And Deena.
Yeah, I would just say one word, which is partnership. And at least from my perspective, you know, I think there's certainly too much siloization in healthcare in general, but from the investor's perspective, conversations like this are so critical. We want to be meeting with you at the clinical stage, at the care delivery stage. We want to hear from patients. The best way to scale these types of hopefully outcome changing technologies is by working together. There's no way it can be done in isolation. So I hope to do more of that and invite anyone who's listening in to do the same.
Awesome. Thank you all. Wish we had another 45 minutes, but thank you for this lovely keynote panel. Very, very appreciative. Thank you.